Hey guys, we're from the National Council on Alcoholism and Drug Dependence, and today we will discuss substance abuse and its effect on the heart.
To give you a rundown on today's topic, first we'll talk about the normal function of the heart. Then we're going into the effects of alcohol, marijuana, and cocaine on the heart. So let's get started.
Organ which pumps blood throughout the body via the circulatory system, providing the body with oxygen and nutrients, as well as removing waste products such as carbon dioxide. It is divided into 4 chambers, the 2 upper chambers being called the atria, and the 2 lower ones being called the ventricles. 2 main pathways of the circulatory system, first one being the pulmonary circuit and second being the systemic circuit. The pulmonary circuit starts off with deoxygenated blood leaving the right ventricle and traveling to the lungs via pulmonary arteries and returning back to the left atrium as oxygenated blood via the pulmonary vein. The systemic circuit is responsible for supplying the body tissues with oxygen. Blood leaves the left ventricle into a large artery called the aorta, and from there enters the arteries and capillaries for the rest of the body. Afterwards, the deoxygenated blood and waste products return to the heart via the superior and inferior vena cava, entering the right atrium of the heart. At rest, a normal healthy heart beats at 60 to 100 beats per minute. However, this can change based on the demands of the body, such as exercise. Drugs and alcohol can also affect heart rate.
So why talk about alcohol? Excess alcohol consumption causes an average of about 4,700 deaths among high school age students each year. In 2011, 19 to 30% of students in grades 7 through 12 in Canada reported consuming 5 or more drinks on a single occasion. And it was found that alcohol use is twice as prevalent as marijuana use. So alcohol has actually been used in the medical field for many years as an antiseptic, a disinfectant such as being applied to the skin before a needle is inserted, or to disinfect the hands of healthcare providers, and also as an antidote for methanol toxicity. It can also be used in daily mouthwashes to help get rid of bacteria. So it seems that alcohol use may not be all that bad, which is true if you're consuming it responsibly. But a study conducted in 2010 by Hampton and colleagues, they demonstrated that moderate consumption of alcoholic beverages rich in polyphenols, such as red wine, contributes to reduced risk of cardiovascular disease. The effect of alcohol was dose dependent, and it was impacted by consuming a meal prior to consumption, but nonetheless, it does go to show that responsible use of alcohol is not necessarily detrimental to the heart. Overconsumption of alcohol or binge drinking, on the other hand, can lead to increased risk of cardiovascular disease because it can cause problems in the inner lining of blood vessels. There have been beneficial effects seen on the heart with moderate alcohol consumption. Heavy alcohol consumption does act as a stressor for the heart, and it causes inefficient contractility and decreases blood pressure. This can increase the risk for sudden cardiac death and promotes abnormal heart rhythm. Chronic alcohol use also causes alcoholic cardiomyopathy, which is distinguished by increased thickness of the heart. Therefore, heavy alcohol consumption can increase the risk of morbidity and mortality caused by cardiac events.
Marijuana is often used as a therapy for moderate pain management associated with chronic diseases. People suffering from multiple sclerosis or Parkinson's disease experience nerve and muscle pains that can often be alleviated with marijuana. In cancer patients undergoing chemotherapy, medical marijuana can also be used to alleviate nausea and increase appetite. 21.5% of high school students reporting using marijuana at least once in the span of a year, and 12.5% of those students reported marijuana use daily. Marijuana produces its effects through the binding of active component, THC, to receptors located all around the body, including the blood and the brain. Once marijuana enters the bloodstream, it reduces the amount of oxygen blood could carry around the body. This reduction of oxygen is sensed by the heart, causing it to beat harder and faster. Since less oxygen is carried by the blood, less oxygen can also reach the heart muscle, making it more difficult for the heart to beat harder and faster. These effects of marijuana often lead to an increase of chest pain and an increased risk of a heart attack. Smoking marijuana has the most dangerous effects in individuals who already have a heart condition or have previously experienced a heart attack. Individuals who are at risk of having a heart attack are 4.8 times more likely to have one if they are smoking marijuana.
1.2% of people over the age of 15 reported using cocaine during the last year in 2015. 3.5% of youth aged 15 to 19 reported cocaine use during that same time period. And in 2015, cocaine was ranked 3rd in the top 5 substances used in the past year by Canadians. A decline in cocaine use was seen from 2008 to 2013, but since then, rates have steadily been going up as of 2015. Despite its current reputation as a recreational drug, cocaine does also have a clinical use. It was used as a local anesthetic that can be applied to certain areas of the body to cause loss of feeling or numbness in that area. It was at one time commonly used for nasal surgeries. If it is being used as an anesthetic, it can be administered either as a solution or a paste, and if it's being used in a clinical setting, it has to be used under the direct supervision of a doctor. Outside of a clinical setting, there's never really a responsible use for cocaine. The use of cocaine has a number of different effects on the body, and a lot of these are on the cardiovascular system. In fact, it's the leading cause of drug abuse-related visits to the emergency room, and most of these visits are due to cardiovascular complaints. Cocaine causes blood vessels throughout the body to constrict, leading to an increase in blood pressure. It can also induce cell death of smooth muscle in the blood vessels and weakening of vessel walls, which can lead to tears in the aorta, coronary artery, and the carotid artery. Cocaine use also increases the risk of developing blood clots and has been shown to induce inflammation of the heart muscle and impairs blood flow to the brain.
In addition to this, it has been increasingly heard of over the past few years of the lacing of fentanyl in recreational drugs in Canada. Fentanyl is a powerful synthetic opioid medication that's 50 to 100 times more potent than morphine, typically known for its strong pain-killing effects. According to the Daily Mail, this has sparked a public health crisis in Canada, with over 1,000 deaths due to overdose in 2017 alone. Fentanyl will cause a dose-dependent depression of the respiratory system, which will cause a lack of oxygen being delivered to tissues. A decrease in myocardial oxygen consumption could potentially explain the decrease in peripheral blood pressure and heart rate when doses of fentanyl increase. Some common things to look for someone who's experiencing a fentanyl overdose is pinpoint pupils, dizziness or confusion, loss of consciousness, profound slowed heartbeat, very low blood pressure, or dangerously slowed or stopped breathing. If you ever encounter someone experiencing a fentanyl overdose, contact 911 immediately. Also, the government in Ontario now provides free naloxone kits to temporarily reverse an opioid overdose. Naloxone is a medication that blocks opioid receptors and can quickly stop the effects of an opioid overdose.
So, moral of the story is to always make informed decisions and know the risks that can happen when doing drugs and consuming alcohol. You only have one heart, so make sure you take care of it. Thanks for watching our video. Hope you guys enjoyed it, and
Remember to like, comment, and subscribe.